early detection through screening of cancer
Cancer,
is
okay.
critical to improving outcomes and reducing long-term healthcare costs. I'll try not to mumble. So, National Cancer Institutes are designated cancer centers that deliver cutting-edge cancer treatments to patients in communities across the United States. Yet there are no NCI designated cancer centers in Arkansas, Mississippi, or Louisiana, states with some of the highest cancer mortality rates in the country. Arkansas has been working really hard on that designation for the last several years. We know that strong federal partnerships are essential. We really would like your help as we go forward with that, again, in providing this ability. How can we help HHS prioritize investment in prevention, screening, and infrastructure, particularly in rural regions, to improve cancer outcomes? You know, you talked earlier about what can we do to, really get a handle on, certainly nutrition's important, but again, besides that, as we go forward.
We need cancer treatment, and I'm aware of the application by the University of Arkansas to get an NCI designation, and I'm very anxious to help you with that.
Good. Thank you very much. As chairman of the Ag Committee, I appreciated your comments last week in the House recognizing the difficult position our farmers are in. I'm concerned that rural America is struggling, especially our farmers. Nearly half of Arkansas's counties lost population between 2022 and 23. That would be true of most of our rural counties in America. Farmers and rural Americans often face barriers to accessing health care, and including provider shortages and transportation challenges. Providers in rural communities struggle to keep the doors open, leading to gaps in care. Programs like the Rural Residency Planning and Development Program would be especially effective in helping train and retain physicians in underserved rural areas. We're in the process now of working on a farm bill, doing some things to support not only the farmer, but rural America in general. How can we partner with you? How can we partner with the HHS to develop sustainable health infrastructure that ensure that federal policies help attract and retain providers in healthcare deserts?
We have a number of programs under HRSA that are intended to do just that. One of them is the 340B program, which is very controversial. It's now under litigation. But we understand the importance of that program to rural hospitals. The GME program, which is designed to get providers, badly needed providers, into those regions. I would also stress that we're about to see a revolution in AI, and AI, I had a showcase of an AI nurse yesterday, which is just an extraordinary innovation that could revolutionize health delivery in rural areas. We met with companies that are building apps that are now used by millions of people that give direct access to health records and give transparency and the ability for people to immediately discern, and wearables also give the capacity for people immediately to discern which direction they're going in on a whole parade of metrics, and allow you to, even as you eat food, to in real time evaluate what it's doing to your body and to take control of health. And I think in rural areas, particularly those areas that don't have access to hospitals, that it's going to revolutionize. I'm very excited about that as an innovation that can transform rural health care. But I also understand we got to keep those institutions in those regions because they're important economic drivers. And for people who really do need to visit an urgent care or an emergency room, they're life-saving. So I want to work with you and do everything that I can, and the other senators, both Democrats and Republicans, want to make sure that the 60 million Americans who live in rural areas and who are critical to our culture, to our economy, to our history, and to every other value, that it's critical to keep them in those areas and healthy.
Okay. Thank you very much. Thank you, Madam.
Thank you, Mr. Secretary.